Hey, and welcome back to another episode of Beaufort Business Banter, where we take a little time every single week getting better acquainted with local business leaders, folks who are spearheading local charities, and some local elected officials. I'm Will McCullough, and I'm the host for this program, and I'm with Century 21 Coastal Town Realty, and we are the sponsors for this show. My guest today is Dr. David Stallings, sorry for mispronunciation, of Cornerstone Physical Therapy and Wellness. So thank you for being on with us today.
Yes,
I appreciate you coming in.
Thank you.
Let's just jump right into it and take a little time getting to know you better. How long have you lived in the Beaufort County area? How long have you been in this neck of the woods?
I moved here in 2012, so a little over 12 years now.
Okay, excellent. And wife, kids, pets, anything you want to share as far as that realm?
So yes, my beautiful wife, Chelsea, she's a pediatric nurse practitioner. Right now she's staying at home with our babies. We got 2 children. Charlotte is 4,
Okay.
and Finn is 2.
Excellent, excellent. So that's really good. So obviously physical therapy, which we're going to talk about here in just a minute, but previous to that, any previous job types you'd like to share? Like what'd you do before?
I worked on a landscaping crew. I was what's affectionately known as the whipping boy, and I had to get the weed eater out every time we stopped. I didn't get to ride any of the expensive equipment. I was the weed eater guy. So I did that for a long time. High school, I worked at a tire shop in college, changing tires and brakes. So those were some interesting and fun jobs I had.
Excellent, that's really cool. So you've done a lot of things. You had your background in what you just mentioned, and obviously now you have these various practices with Cornerstone. I'm sure there's a lot of answers to this question, but maybe picking one, what would you say if you could just write your epitaph, one key to success that you like to share? What would you say is a key to your success?
So one thing I always like to say about being successful, I really think is showing up, being there when you're asked to be there. You have the knowledge for your particular field. You have the desire to do well with your patients, with your clients, and just show up. I think it means a lot too as a dad. I've got my 2 children, and I want to be there for them.
Okay.
So I don't have to show up and do anything special. I just have to be there, and if I'm there, that makes a difference.
Excellent. All right, well, that's a really good answer and a very unique one. We haven't heard anything like that.
Yeah,
It makes
cool.
a lot of sense. So thank you. So I am, full disclosure, a really big, genuine fan of your practice and how you run your business and some of the things that make your physical therapy business, in my perspective as a layman, different to most of the others that I've perhaps encountered in my own existence. So why don't you take a little time and just tell us about Cornerstone Physical Therapy and Wellness and anything you'd like to share. Let's hear it.
Cornerstone Physical Therapy and Wellness, one thing that we strive to do that kind of sets us apart from other physical therapy practices is that we like to promise our patients that we're going to treat them individually or one-on-one. I've worked in different practices before, and typically as a therapist, you are given a patient and then you will be given another patient, and you've kind of got to run between the 2 of those. And in some places it's more than that. And it's very difficult to give very high-level care when you're being split multiple different ways. So that's really what we started with at Cornerstone, was each individual patient is going to get their individualized one-on-one time. And so that's really what sets us apart.
So I just want to make sure I understand this once again from a layman's perspective. Excuse me. I've had physical therapy in the past, and my experience in that was, I go in, they give me a sheet with some exercises, get me started, and then they bounce around to other patients within there. Are you saying that that's not the case stereotypically with Cornerstone?
Right. So when you come into Cornerstone, you're going to come in, we'll bring you into the gym. We may have you warm up on something. And from the time we take you off that piece of equipment, you're with your therapist the entire time, and your therapist is undivided to you. Now, you may look at that from a standpoint of making money and profit and say, well, you can make more money if you treat 2 patients at a time. And while that's true, we don't make the same relationships with the patients who come in and with our community, and we don't create lasting patients who are going to come back to us the next time they have an issue. And that's really what we're striving to do.
Excellent. What else about Cornerstone that you might potentially like to share?
Well, we've got 3 locations. We have 2 larger practices over in Bluffton. We started the first one there in 2012, the second one in 2018, and then we opened up here in Beaufort a year and a half ago.
Okay.
So the one here in Beaufort's rather new.
And where is that physically located?
So that's on Robert Smalls Parkway.
Mm-hmm.
It's right across from Lowe's, right beside Harbor Freight Tools. So most everybody knows where those two places are. It's 154 Robert Smalls.
Excellent. And Dr. David's contact info is going to be up on the screen if you need to reach out or set an appointment, which brings me kind of segues unintentionally, but perfectly into something I wanted to ask you. My perception has always been that physical therapy is like, I go to physical therapy because I was referred to that by my doctor.
Sure.
If I have an issue or some problems going on, or a limp or a pain or something, do I need to have a referral to go, or can I just make an appointment? And
you can just make an appointment. That all depends on your insurance. So many times people try to utilize medical insurance to come to physical therapy, and if you have medical insurance, you should utilize it. If you have Medicare or if you have TRICARE, then you have to have a referral. So they have to.
I'll make sure I dig down on this. So for Medicare and TRICARE, you need to come with a referral if you want that to cover it.
You're right. If you have any of the private pay insurances like Blue Cross Blue Shield, Aetna, Cigna, any of those bigger name, United Healthcare, those will allow you what's called direct access, where you can come straight to your physical therapist without a referral from a physician, and you can be treated.
Excellent. Excellent. Anything, once again, there's no time limit. It's not a quiz. If there's no answer to this, that's fine. But anything else that we haven't covered that you'd like to kind of get off your chest and share with the masses who may be watching this at some point?
Well, I guess from a physical therapy standpoint, like we already said, we really strive to provide that individualized care. Another thing that we kind of do in our practice is we only have licensed therapists. So in a physical therapy setting, you're going to find multiple different types of people maybe working with you. You're going to have your physical therapist. They may have a doctorate degree, they may have a master's degree, but they're the physical therapist. Then you have a physical therapy assistant. That's a licensed individual who has usually a bachelor's degree and then a secondary associate's degree in physical therapy. And then you'll have technicians or aides. Those are individuals who do not have licensure to be treating you. And in fact, I was a technician for years. I actually was a tech in undergraduate. I worked through college at a physical therapy practice as a tech. And I remember being brought patients, and I would work patients through their entire session. They would never even see their physical therapist. I didn't have any physical therapy training, but I knew how to do those exercises. And so I see that as a lesser level, and I want my patients treated with someone who has a license and specialty education at an accredited university to do that care. So we only have physical therapists and physical therapy assistants. So that's something else that'll make us different than the next place.
Well, that's good info. And once again, Dr. David's contact info for Cornerstone is going to be up on the screen. Well, obviously, I own a real estate brokerage and we sponsor this thing. So let's toss the ball the other direction for a second. Anything top of mind that I can potentially, and I say potentially because who knows, but throw something at me. What can I answer for you?
So here we are today. The news says at 2 o'clock the Fed is meeting and we are supposed to have reduced rates, interest rates today. And so what's that going to look like for the real estate market around here?
Well, that's a really good question, and I will disclose off the top. I don't know. So, I've always told people that ever since 2008, I threw my crystal ball away as it relates to anything real estate. So we always try to, make predictions, but who knows? So yeah, so supposedly today at 2, the Fed is probably going to be reducing rates a little bit. How much is that? I've heard, a quarter point, a half a point. We don't know until it's actually announced and it happens. No matter what, though, I don't think, and don't quote me on this, somebody could probably, correct me, but I think it's been almost 4 years since we've had a reduction in rates. So no matter what, rates being where they are have had a very direct and tangible negative impact on the market overall, especially with younger kids, first-time home buyers who are, it's just been brutal for them. Couple that with just rising appreciation, things of that nature, and it's made home ownership unobtainable for a lot of folks. So I mean, that's not a surprise or anything new to anybody. So it's also not only made individuals who are looking to purchase and acquire tough, but it's made folks who want to sell. If somebody needs to sell, I'm moving, I have a different job, I'm military, I have orders, they're selling. Yeah. But a lot of folks who may want to sell because their life situation has changed, maybe they want to downsize, or maybe their family has expanded and they upsize, have chosen not to sell over the last several years. Many of them have, because they know they've been sitting on a home with a 3.5% rate. They don't want to give that up to be something closer to 7, because that's a very significant difference in pay, because especially if they're upsizing because their family has grown or whatever. So I would hypothesize that any change of rates that's going to come down to interest rates going down on somebody's payment is going to allow some of those folks to decide, you know what, now is the time for me to go ahead and look at putting this on the market. So I would say, I would expect to see more inventory, painting with a broad brush and just speaking in generalities, both from a hyper-local perspective and just nationwide. Any reduction in rate is going to create more inventory coming on the market, and then more product and it's going to be easier for buyers. So that will help the market overall. How much that will help remains to be seen, because it depends on the amount of rate and, of course, other factors with the economy or whatever. So overall, for the real estate market and real estate sellers and buyers, it's a net positive for everybody involved. So I don't know how well that answers your question, but my prediction is more inventory, more people being able to enter the market. The funny thing is we may not see that effect, and I'm making this up, but I'm just thinking about it. We may not see much of a tangible effect from that change immediately, because historically this time of year, from late September through December, is a slower time for the market, because not as many folks say, you know what, I want to put my home on the market right before Christmas. So there will be people coming on or whatever, but we may not see the full impact of a rate change until the next quarter and after the holidays. But no matter what, I would say it's a net positive. And ironically, it's taking place right before elections. So imagine that.
Well, as a business owner, I'm always looking to recruit people to bring in. And when I'm recruiting a young physical therapist to come to this area, when it's difficult for them to purchase a home, it's difficult to recruit. So I'd like to see positive movements in your field. That helps my field.
Well, I can't imagine that it would be received as anything but a positive impact on the market overall, both for buyers and for sellers. It increases affordability, and along with that, an increase of inventory creates more options. And when there's more inventory, those sellers tend to be more negotiable, because they have to compete with each other for those buyers. So for all, I think it's a good thing if and when it happens. And we'll know pretty soon.
Less than an hour.
Anything else Cornerstone related you want to pipe in with?
No, I think that's about it.
Awesome. Well, thank you again for joining us. This is Beaufort Business Banter, and I'm Will McCullough, owner and broker in charge of Century 21 Coastal Town Realty, located at 83 Sam's Point Road on Ladies Island. If you're ever curious about buying, or curious about selling, or maybe even curious about starting your own career in the local real estate industry, I would love to speak with you. And I think with that, we've done it. That's a wrap. So thank you, Dr. David. Great having you on here today.
Good deal. Yes, sir. Thanks.
All right, thanks, guys.